When someone is diagnosed with breast cancer, there's a flood of emotions that goes through their mind. In today's Living Healthy, we are talking about the process from diagnosis to treatment. We welcome in Dr. Spears, radiation oncologist with the Cancer Center of Hawaii. Hello, doctor.
Nice to meet you.
Nice to meet you. Thanks for joining us. Doctor, walk us through the process. You know, when someone is just diagnosed with breast cancer, like I said, you know, I'm sure that there's a lot of fear, they're frightened, they don't know what the next step is. Can you tell us what is the first step?
Well, first of all, many of our patients feel exactly those same feelings, and it's understandable. Breast cancer is scary. Patients don't know how their lifestyles will change, and they don't know how their friends and family will react. So we take a good portion of that first visit to comfort them with the fact that this disease is usually very treatable and that the treatment currently is light years ahead of where it used to be and is more tailored now than ever before.
Mm-hmm. And I know that we've talked in the past about mammograms, right, and how important they are. And it's because if you catch it early, it is so curable and treatable.
Absolutely,
right?
absolutely. That's why we stress, you know, getting ahead of the mark rather than running afterwards.
Right. Okay, so that's the first step. And what's after that?
Well, so usually the first person, a patient who's just been diagnosed with breast cancer, the first person that they'll see is their breast surgeon. And that breast surgeon will usually guide them through the imaging workup and present them with their surgical options. And that can vary from getting the tumor and part of the breast removed all the way to taking off the whole breast, as well as dissecting the lymph nodes in the shoulder and in the arm. And you know, many patients will do that surgery as the first step, although some patients may get chemotherapy first.
Okay, but again, you've got doctors along the way that can help them with that process, because even as I'm sitting here, I'm imagining going through that, and you know, you're probably flooded with information right off the bat, and then of course most people go online and try to get their own research.
Yes, which is good. I mean, that's something that I would absolutely do, but it can increase the anxiety you feel about the diagnosis you've just received.
Absolutely, and everybody's different, right?
Yes.
And the treatments too are different.
Absolutely, the treatments are different. So in addition to the breast surgeon who you usually meet first, depending on the type of surgery you've had, you might see someone like me, a radiation oncologist, as well as a medical oncologist to discuss hormonal therapy or chemotherapy options for treatment.
Okay, so as a radiation oncologist, you just focus on the radiation part of the treatment?
Yes.
Okay, and the medical oncologists?
Will deliver chemotherapy options as well as hormonal therapy options. Some patients, many patients actually nowadays, have hormone receptor positive breast cancers, and that's just part of how this disease has become much more tailored. We can see what markers the breast cancer cells have and tailor the treatment accordingly.
Okay, that's great. Anything else someone watching should know?
Well, I'd want to tell women that have just been diagnosed with breast cancer that they shouldn't worry about memorizing everything or coordinating everything. Once they find doctors that they trust, they should just trust the process, because even though the journey is new to them, the path is well traveled, and that's why we're here.
That's true. And there's there's a lot of people out there who can help support you.
Yes.
Right?
Yes.
And like you said, along the way, I know a lot of women too worry about their hair loss or the different side effects. But again, if you look at the big picture and you just kind of do what your doctors recommend that you do, you know, you'll get through it.
Absolutely. Yeah. And depending on the type of treatments that you get, as we have talked about before, your side effects may vary. So it's not a stereotypical treatment path for anybody, although each step is in place for people if they need it.
Okay, and getting educated is
the first
so
step.
Important.
So
yes,
important.
Doctor, thank you so much.
Thank you for having me.
We'll have your contact information on our website, because I'm sure people may have additional questions or maybe want to learn more about the Cancer Center of Hawaii.